Hello and welcome. You're watching FYI. I am Sonal Mehrotra Kapoor. Now, allergies on your food plate. Are you aware that you could be allergic to some particular amount, quantity or kind of food that is leading to various reactions in your body and perhaps you don't know? A lot of us by now know about food allergy related to milk, for example, to seafood, for example. But what about gluten? How understood or misunderstood perhaps that is? That is what we're going to pick up on the program today. And also we'll tell you some solutions, how to know that you are actually allergic to something. All right, so let's get into our explainer and we start by telling you food allergies versus food intolerance. There is a difference. So the first thing to know is to get that straight out, right? So food intolerance is a much more common reaction. Food intolerance is less serious as well, and it doesn't really involve an immune system response. It is, intolerance could be in certain cases a start to you getting your body getting repulsed by that kind of food altogether and developing into an allergy altogether. But there are some symptoms that you must watch out for. We'll get into the specifics later, but just some basic symptoms that you must watch out for, mild to moderate, whether or not you have a food allergy. Itchy sensation, very common inside your mouth, throat and ears. Suddenly if you get something, that can mean that you are getting an allergic reaction to something you've eaten. Redness, itchy areas on your skin, absolute giveaway that you are getting an allergy. Swelling on your face, persistent dry, itchy rash, dizziness, diarrhea, abdominal pain, runny nose as well, wheezing, nasal congestion, sneezing, slight dry cough, lightheadedness or fainting. All of that means that there is an allergy of sorts that is at play. When it comes to food allergy, in India specifically, milk and gluten really dominate that domain. So we thought we'll bring you what exactly is milk allergy and what is lactose intolerance altogether, because they're two completely different things and it's good to know the difference. Now, milk allergy basically shows up early in life. Lactose intolerance is, on the other hand, more common in a sense. You are intolerant to anything that has a component of milk as well. Now, lactose intolerance takes longer to develop as well. Intolerance can occur at any time of your life. A lot of people realize that they are lactose intolerant much later in life as well. So it can happen. It is not always genetic, though in some cases it can be. Lactose intolerance can be caused by intestine damage. Lactose intolerance can also, the symptoms can last from 30 minutes to almost 2 hours. Milk allergy symptoms, on the other hand, may be delayed but by several hours as well, and they're really different for different people. Let's jump into gluten intolerance next. Now, gluten in wheat, barley, rye, that basically means that you can develop diarrhea at times, fatigue, skin reactions, depression, anxiety. A reaction in response to gluten, believe it or not. Weight loss in certain cases is a reaction to gluten intolerance. Iron deficiency, anemia is also a symptom. The autoimmune disorders are a symptom. Leg and arm numbness is a symptom. Joint and muscle pain, even constipation is a symptom that you could actually be gluten intolerant. So what do you do? If you're seeing any of these symptoms, what do you do? Well, tests, ample of them available to be done. Skin test, for example, is a good way to start. It determines the reaction to particular food. Small amount of suspected food placed on skin or forearm or on the back as well. They test it like that. There is a skin prick, which is very Instagram friendly test these days. Tiny amounts of substance beneath your skin and surface is pricked in to see if there is a reaction to that. If a bump comes in, then you are indeed allergic to something. A positive reaction alone doesn't confirm allergy. Remember, you have to undergo several other kinds of tests to know for sure. Let's jump into the next kind of test then, a blood test. That is really something that can be taken. There is an allergy related antibody test, mostly like that. The samples are taken and they go back to the labs and they check for antibodies. We all understand that thanks to COVID, that what exactly antibody test is all about. And how to actually detect a food allergy, if you can easily get a test done There is a food elimination technique as well that doctors at times get into if they want to understand how exactly your allergies are playing out. But since it's festive season and a lot of us don't always understand what exactly we are putting into our body and how our body is responding to it, we thought it would be nice to do this program now and also bring you a mix of guests now. We've got Dr. Shelly Mahajan with us. She's a lab director at Mahajan Diagnostics to actually help us understand what kind of tests are there out there for people to know. We've got Dr. Pawan Raval with us. He's a head at Gastro at Artemis Hospital in Gurugram. And we also have with us Dr. Soumya, who is a clinical associate professor and dermatology at Amrita Hospital in Kochi. Dr. Soumya, if I can begin with you. Not everybody starts to know or knows that they are living with some food allergies. A lot of people even get to know this at a very later stage or when things get really bad in their body and they need hospitalization. In your opinion, the way human body and Indian body immune system is evolving, and it's an evolution like we all know now, which way is this going in the Indian subcontinent? Where do you think some of the allergies that people are wildly unaware of, some of them that you can point out?
Right, it's a very good question to start with, because then it helps us to put things into perspective. Because food allergy, as we know it, we are mainly only concerned about the immediate food allergies. So food allergies can be immediate, which we all know about and which we can't miss really, because you consume a particular food, for example, nuts or eggs or shellfish or whatever, and your body produces a reaction immediately, whether it's hives or whether it's like some kind of, like you said earlier, respiratory issues, breathlessness, cramps, all those things. So you won't miss it usually, and it's very well picked up earlier enough. But what happens is you also have different other kinds of food allergy. That's importantly the delayed kind of food allergy, which is often missed. This can present as like people who are eczema prone, they may have a kind of exacerbation, aggravation of eczema or some other allergic symptoms or respiratory symptoms, or you could even have a mix of these things. So particularly in an Indian setup, we sometimes have a misconception that if you are not allergic, if you've been taking a food for some time, you may not develop allergy to it. This is a misconception you may develop. And also the additives in the food, which we also call pseudo-allergens, they can also trigger these kind of reactions. So many additives. We don't have exact nowadays our labeling regulations are better, but these are also often missed in our country. So it's very difficult for somebody with food allergy to kind of understand what exactly they're allergic when you have a lot of things mixed in.
Right. So what exactly are the tests available then? Before I get into that question with Dr. Shelly Mahajan, I want to bring in Dr. Raval on a question that has really troubled a lot of people. And Dr. Raval, milk. Can I just talk about that first? Indians love it, consume it throughout our lives in different forms. Diwali is just around the corner. There will be lots of sweets doing the rounds which will have a milk component. But I keep reading papers on research papers on how more and more Indians are now getting milk intolerant, not lactose intolerant, but milk intolerant. Is there a reason to this? Is that your observation as well, and how to tackle it?
Yeah, it's a great question. Thank you for bringing this out. First of all, let me compliment you. Already cleared about what is milk allergy and what is milk intolerance. So we need to differentiate between the two. There are two kinds of milk intolerance. One is called primary and second is secondary. Primary milk intolerance increases with the age. In Asian population, in Indian population, there is enough data which suggests that once a child grows from 5 years of age to adult, maybe around 30 or 40 years, around 30% of the people would have some kind of milk intolerance, maybe complete or partial.
That's a huge number.
Yeah, that's a huge number. So, but then most of the time it's partial. This means that if you decrease the lactose in the diet, then probably you may tolerate it. Some kind of yogurts and curds can be tolerated, and cheese and milk sometimes can be avoided. Then very important is the secondary lactose intolerance or milk intolerance, which develops when there is some infection, some diarrhea, or some kind of gastrointestinal damage that happens. So the enzyme lactase that goes away and there is a lactose intolerance, but that is transient. And you need to stop milk for some time and gradually the things would come back. So yes, we have huge number. We are finding more and more cases of lactose intolerance, but I would say it's more a lot of awareness as well. It's awareness among the physicians and the people in the population and the patients who are more aware now, and their symptoms are getting better controlled by decreasing the milk in their diet. So both the things that have happened over the time.
Right, 30 to 40% of Indians, by the time they reach the age of 30, are already showing some sign of milk intolerance. That's a huge figure, really, and that's something all of us need to be aware of. We often actually take it as gastro problem, something else, but it's so difficult to pin down on what exactly is causing that reaction in your body, which is where Dr. Mahajan actually comes into play. Please take us through what kind of tests we can do on kids and on adults to know early on, before you have really put your body through hell, to understand what kind of food allergies you might be undergoing.
Right. So to start with, I'd like to say that any test that we do for food allergies, it has to be correlated with some sort of clinical history, right? So we have to take everything in a complete context and then make a decision on whether or sort of brand a person to be allergic of one kind of food, because it essentially means that we are restricting the person to have that food for life, right? So and again, as you said, making a diagnosis is also important, because food allergy, unlike food intolerance, as you said, a reaction can be as mild as a rash or mild itching, or it can be anaphylaxis, which means swelling of your throat and of your face, and can be very, very serious. Now, coming to the tests for food allergy is basically, of course, they revolve around the pathogenesis of allergy. That means what is happening here? What is happening when I'm ingesting a food which I'm allergic to? There are certain small protein molecules on the food which are called allergens, which will activate my immune system in a way which is much higher than how it should react. So that means that my body is considering that food material to be a foreign particle, maybe a virus or a bacteria, and my immune response is fighting against it.
I see.
So what happens is that essentially, and thanks to COVID, as you said, people are now, a layman now understands how immune system works. So T cells are activated, then B cells are activated, and eventually Ige antibodies are produced. Now, what are Ige antibodies? Ige antibodies, if exposed to more allergen, they will activate mast cells, which will release a chemical called as histamines. And histamines are what are...
Can I just interrupt over there and say that before we get into all the clinical details about how it actually works, etc., could you also, the big takeaway for our viewers would be if you could tell them some tests that are out there and how affordable or not are they for people to undergo in case they're facing this. Of course, they have to do this only if their doctor advises them.
Right. So yeah, that's what I was coming to. So this is the IgG is what we are trying to detect. So essentially, commercially, there are two tests available: a skin prick test or a blood test. In a skin prick test, we are a doctor will inject a allergen or allergen extract into the skin, and we will see whether the skin is reacting to that or not. It is a fast and effective method. It has been a traditional method of testing, but there are of course drawbacks, that it is not as sensitive or specific as a blood test.
Right.
Also you are sort of exposing the body to the allergen, so it may very rarely lead to that reaction itself, maybe a mild discomfort or a little serious infection.
Okay. Coming to blood test
is a blood test, which is a serum test. We basically detect allergen specific IgEs. When I say allergen specific, that means so IgE is a very broad antibody. It can be raised in in an asthmatic anyway. So we need to detect allergen specific IgE. Now with the advancement of the technologies, the allergen that we use in these tests have become so specific that it has raised the sensitivity and specificity of this test.
Okay.
Benefit, of course, the body is not exposed to any allergen. It's a fast test. It's a much more sensitive and specific test. But of course, in the end, everything has to be taken into with respect to clinical history.
Sure. So we talked about tests, we talked about sensitivities. It's a good time to take a break. When we come back, we'll talk about how early should you get these tests done when it comes to kids as well. That's coming up on the other side. Welcome back. We're talking about food allergies on the program, and I have last 2 minutes, so let me go to Dr. Raval next up as well. Dr. Raval, you know, abroad, the general practice is that whenever the child is born, they run lots of tests to know early on what is it that the child will be genetically used to, will manage to take, not take. We don't see that practice happen in India. To new parents, to all these the baby boom that is going on in the country right now, what would your advice be on how to tackle allergies when it comes to kids?
Yeah, I mean, there is no protocol of testing the newborn for any kind of allergies. There are certain allergies which are common in India, more and more being diagnosed. It usually depends upon the symptoms. The most important diagnosis is actually done by the patient and family themselves. So you tend to develop symptom, or your child develop symptom after eating, having certain food. That probably is the most important diagnostic test. Others have been told by the respective speakers. Yes, the more focus probably which is going on is from the celiac disease or the wheat allergy or gluten sensitivity. That probably one can take into account, because as you already told, it leads to poor growth, short stature, anemia. That's very important. So nothing specific, be aware of the symptom, that's the message.
All right, so there's nothing to panic over this. Just be aware of the symptoms. There are ample of tests that you can get done as well. Thank you all for joining us. It's been a learning, hearing all of you about these allergies. That's it on FYI today. We'll see you again tomorrow. Bye-bye.